How to treat and cure smallpox. Smallpox was an infection that was caused by the virus called variola virus. For thousands of years, smallpox created severe illness and caused the death of hundreds of thousands of people. When it was introduced into the Americas from Europe in the 1500s, it killed many of the native populations. As late as the 1800s it was still causing the deaths of thousands when introduced into susceptible populations, such as in Hawaii, by European explorers. Fortunately, this virus was eliminated as a natural cause of disease in 1977 through effective use of vaccination programs. It is the only disease ever to be deliberately removed from the human population. It is thought, however, that this virus could be reintroduced as an agent of biological warfare. This is because the virus is very contagious, can be spread from person to person, and can cause serious illness, even death, if an individual is not vaccinated within 4 days of being exposed to the virus. Since antibiotics only work against bacteria, not viruses, they are ineffective against the smallpox virus. There is no known cure. Prior to 1972, vaccination against smallpox was standard procedure. Since that time, general vaccination against smallpox has not been recommended and therefore has been unavailable to the general population. It is thought that protection gained from the vaccination against smallpox lasts a maximum of 10 years. It is believed that few people in North America currently have protection against this disease. In light of current terrorist activity, the American and Canadian governments have acquired their own emergency supply of smallpox vaccine. These vaccinations would be used to vaccinate any people exposed to the smallpox virus should this become necessary. Causes. The smallpox virus is passed from one person to another through inhalation of air droplets or aerosols. Therefore, it is important to isolate a person diagnosed with smallpox and not have face-to-face contact. The disease is spread most easily during the first week of infection. But the risk of passing the virus to another person lasts until all scabs have fallen off. See symptoms and complications. Clothing or bedding can also spread the virus. As a weapon of biological warfare, it is most likely that the smallpox virus would be spread through the ventilation systems of buildings. The viruses would only stay alive for 1 or 2 days within the building, but by that time many people may have become infected. Since it takes about 2 weeks for the symptoms of smallpox to develop, it is unlikely that the source of the infection would be discovered in time to do anything about it. Smallpox can be passed between people in any climate, but it spreads most easily in cool, dry winter months. Symptoms and complications. On average, the time between coming in contact with the smallpox virus and developing symptoms, the incubation period, is 12 days. The first symptoms of smallpox are high fever, fatigue, headaches, and backaches. A rash that appears mostly on the face, arms, and legs starts about 2 to 3 days later. The rash starts out as a flat, spotty, papular rash, but soon develops small vesicles, clear fluid-filled lesions, and then later the lesions become pustular, filled with cloudy white pus. The pustules, pus-filled lesions, are usually deeply embedded in the skin and are round and hard. As the pustules continue to get bigger, the person with smallpox is usually in a lot of pain, and the high fever continues. Crusts begin to form on about the 8th or 9th day of rash. Scabs form and separate, leaving deep, pitted scars. Death from smallpox typically occurs in about 30% of unvaccinated people developing the common variola major form of the disease. In those who have been vaccinated, the death rate is about 3%. One variant of the disease is called variola minor, and the death rate from it is less than 1%. These estimates come from the rates of death before 1972, the last naturally occurring case of the disease. Many of the deaths occurred from bacterial infections getting into sores. Good wound care is thus extremely important. Death from smallpox usually occurs during the second week of symptoms. Making the diagnosis. Smallpox is initially suspected through appearance of the symptoms described above. The early symptoms, first 2 to 3 days, of smallpox could be confused with chickenpox and other similar diseases. The differences are that the chickenpox rash is denser over the trunk, while the smallpox rash tends to occur to a higher degree on the face, arms, and legs. The symptoms of smallpox are much more severe, for example, high fever, muscle aches, than those of chickenpox. And the entire rash associated with smallpox evolves at the same rate, from all the lesions being papules to all becoming vesicles, to all becoming pustules at the same time. In chickenpox, the rash occurs in various stages. In some areas there are papules, in others vesicles, and in others pustules, but all three types can be seen to be present at the same time. To confirm the diagnosis of smallpox, a health official wearing gloves and a mask collects a piece of scab or the fluid inside the vesicles or pustules. The diagnosis can be quickly confirmed in the laboratory through use of an electron microscope and confirmed by culturing the virus from the scab or fluid. Treatment and prevention. There is no known specific treatment for smallpox, although research is being carried out in an attempt to create a medication capable of killing the virus. Control of fever, prevention of dehydration, good wound care, and antibiotics for any secondary infection caused by bacteria are important measures for the smallpox patient. If a case of smallpox were diagnosed, that person would be isolated from other people immediately. And all people that had been in contact with that person would be isolated, vaccinated, and watched closely for signs of the disease. Vaccine that is given within 4 days of exposure to the virus may prevent or greatly reduce the symptoms of the disease. Currently, smallpox vaccine is approved for use only with those people who are at special risk for the disease. Laboratory workers working with the virus are also vaccinated. If an epidemic were to occur, widespread vaccination could take place, with priorities as recommended by the government. The vaccination against smallpox contains the cowpox, vaccinia, virus, not the smallpox virus. The vaccinia virus, which is related to the smallpox virus, allows the production of antibodies against the smallpox virus by our body's defense, immune system. Certain people are at higher risk for adverse reactions to the vaccine. Most reactions are mild, but some are severe. They include people with eczema or other skin conditions, pregnant women, and persons with circumstances that result in weakened immune systems. For instance, those with cancers like leukemia and lymphoma and people who have had solid organ transplants. Smallpox is caused by infection with variola virus, which belongs to the genus Orthopoxvirus, the family Poxviridae and subfamily Cordopoxvirinae. The date of the appearance of smallpox is not settled. It most likely evolved from a rodent virus between 68,000 and 16,000 years ago. The wide range of dates is due to the different records used to calibrate the molecular clock. One clade was the variola major strains, the more clinically severe form of smallpox, which spread from Asia between 400 and 1,600 years ago. A second clade included both Alistrim minor, a phenotypically mild smallpox, described from the American continents, and isolates from West Africa, which diverged from an ancestral strain between 1,400 and 6,300 years before present. This clade further diverged into 2 subclades at least 800 years ago. A second estimate has placed the separation of variola from Tateropox at 3,000 to 4,000 years ago. This is consistent with archaeological and historical evidence regarding the appearance of smallpox as a human disease, which suggests a relatively recent origin. However, if the mutation rate is assumed to be similar to that of the herpes viruses, the divergent state between variola from Tateropox has been estimated to be 50,000 years ago. While this is consistent with the other published estimates, it suggests that the archaeological and historical evidence is very incomplete. Better estimates of mutation rates in these viruses are needed. With a single linear double-stranded DNA genome 186 kilobase pairs, kbp, in size and containing a hairpin loop at each end. The two classic varieties of smallpox are variola major and variola minor. 4 orthopox viruses cause infection in humans: variola, vaccinia, cowpox, and monkeypox. Variola virus infects only humans in nature, although primates and other animals have been infected in a laboratory setting. Vaccinia, cowpox, and monkeypox viruses can infect both humans and other animals in nature. The life cycle of pox viruses is complicated by having multiple infectious forms, with differing mechanisms of cell entry. Pox viruses are unique among DNA viruses in that they replicate in the cytoplasm of the cell rather than in the nucleus. In order to replicate, pox viruses produce a variety of specialized proteins not produced by other DNA viruses, the most important of which is a viral-associated DNA-dependent RNA polymerase. Both enveloped and unenveloped virions are infectious. The viral envelope is made of modified Golgi membranes containing viral-specific polypeptides, including hemagglutinin. Infection with either variola major or variola minor confers immunity against the other.